Hello, my name is Dr. Claudia Gore. I'm a consultant in pediatric allergy at St Mary's Hospital and Imperial College London. In the last 2 years, the EAACI Adolescent and Young Adult Task Force has surveyed European healthcare professionals on their transition practice, performed 2 systematic reviews, and produced a guideline for the effective transition of adolescents and young adults with allergies and asthma. This guideline incorporates a substantial set of recommendations. We decided to seek the views of adolescents, young adults, and their parents on these recommendations in a Europe-wide engagement survey. It is my pleasure to share the results of this survey with you today. The key question was, are the recommendations important for adolescents and young adults affected by allergic conditions, and are they important for their parents? Recommendations were expressed in lay language, then translated and back-translated into multiple European languages. We invited adolescents and young adults aged 11 to 25 years with allergy and/or asthma and their parents across Europe to participate in the survey. A 5-point Likert scale was used to evaluate the importance of each recommendation, and a free text box allowed for further comments. 19 recommendations covering generic and allergy and asthma-specific transition care were reviewed. In the specific recommendations, there were 3 domains. These covered self-management, psychological issues and help, support from family, friends, and others. 1,210 participants from 24 European countries gave their feedback. Of those, 415 were adolescents or young adults, and 765 were parents. Allergic conditions included asthma, allergic rhinoconjunctivitis, food allergies, eczema, and anaphylaxis. 22% were affected by 4 comorbidities. In the generic section, recommendations included learning to self-manage from age 11 to 13 years, having a transition plan, telling patients and parents how the plan works, using a transition readiness checklist, checking that the young person is able to take their medication and does indeed take them, meeting the adult team before moving on, and children's and adult teams to discuss the patient's care regularly. Adolescents and young adults rated these as very important, important, and fairly important, represented in the light blue to darker blue, with only a minority saying they were not important, represented in red, or not having an opinion, shown in orange. The parents rated the generic recommendations as similarly important. In the specific recommendations, the domain on adherence and self-management included making treatments as simple as possible, using apps, phones, and other methods to help remember taking medication, personalized action plans, focusing on areas where the young person is less confident. Young people can learn from other young people how to manage their life with allergies and asthma, how to manage their social events, and healthcare professionals choosing a motivational conversation style in the consultation. Again, adolescents and young adults rated these as very important, important, and fairly important, with only a minority saying they were not important or not having an opinion. And again, parents rated these recommendations similarly. In the specific recommendations, the domain on psychology and support included items such as looking out for young people who feel anxious or depressed, and checking for other life stressors, as these may affect their conditions. The role of psychologists to help manage conditions. Families should be encouraged to support young people as they start to self-manage. Young people should be encouraged to tell friends about conditions and the management of those. And clinics should be able to recommend good sources of information. Adolescents, young adults, and parents again rated these as very important, important, or fairly important, with only a minority stating that they were not important. All the recommendations achieved at least the median of 4, i.e. they were felt to be important, and many achieved a 5, i.e. very important. The most supported recommendation was healthcare professionals should check that young people are knowledgeable and compliant with prescribed medication. The least supported recommendations were joint clinics with pediatric and adult clinicians, the use of web-based or mobile technologies to communicate with adolescents and young adults. In conclusion, we found agreement on the importance of the proposed recommendations, and adolescents, young adults, and their parents were very supportive of implementing these. Qualitative comments revealed conditional approval for some of the recommendations, making them, for example, context or situation dependent, or adding conditions which needed to be met. The next step is the implementation of the recommendations, supporting the effective transition of adolescents and young adults with allergies and asthma in Europe. If you have any questions, please do not hesitate to contact me or another member of the task force. We look forward to implementing the recommendations with you. Thank you very much.